And her words to me, which still ring in my head to this day, were, look, I'm concerned you might have a cancer somewhere in your body. So I said to the consultant, look, I'm concerned because this tumour mark is going up. I'm feeling worse. The ultrasound was rated as BIRADS 3, which again is no cause for concern. But they did say there was a solid nodule. So I asked for a biopsy to be done or an MRI to be done. And I was told no. I can't stress enough to everybody out there to really know your body and know you're normal. So something might be normal for many other people, but it might not be normal for you, right? That's what happened to me with the chest pain. I was like, well, okay, you're saying it's normal. It's not normal for me. And it does take takes a lot of energy to advocate for yourself. It takes a lot of courage because it's an intimidating situation to be in anyway, right? Particularly and physicians and medics. I've had polarized experiences throughout the last 3.5 years. That theme has continued, right? I've come across amazing, fantastic senior physicians, surgeons, oncologists, and I've come across others that don't fit that category. And it is intimidating to question them, basically. But what I will say to anybody is ultimately, it's your life.
This is Genetics for Healthcare, a podcast for patients.
It is a privilege and a pleasure for me to have Jemma Sutton, a 2-time breast cancer survivor and very much a patient advocate. And she immersed herself in the world of genetics and genomics, and she stopped by to share her story. Thank you, Jemma, for being a guest on Genetics for Healthcare.
Thank you very much, Rome. I really appreciate your platform and having the opportunity to speak on it, to share my story, because although it's my story for me, it's not actually, it's partly about me, but it's about what my story represents in a bigger sense. And that's why I'm here, because I feel that's an important bigger picture and mission that needs to be accomplished. So thank you for your platform.
Well, we're partners in that effort. Here we talk.
Yeah.
And our mission is to help patients advocate to get, access to precision medicine, genetic and genomic information, and to share stories like yours. And, to start, some patients have to fight for access to biomarker testing. Some patients have to fight for access to, scans and different things or different therapies. But you had to fight just to get diagnosed with breast cancer. Tell us about your experience.
Yeah, thank you. So I am a non-standard case, and I feel it's very important that people are aware of non-standard cases, because I know we'll get more into it, but when you don't tick the tick boxes under the standard of care protocols, you get thrown into a whole new world of not fun, to be honest. So what happened with me is back in 2021, we were still under pandemic restrictions. This is the first time I got diagnosed. I've been working on a super big technology project, worked quite intensely. 7 a.m. conference calls, 11 p.m. conference calls. It'd been a quite full-on 6 months or so. And it got to sort of April time, and I started just to feel really exhausted, really unwell, and just weird, like something was up. Didn't really know what. So I went to my doctor saying, look, I feel really exhausted, but not a bit tired, not, you know, um, nothing that a weekend of rest would normally sort you out, wouldn't it? And you can just normally bounce back on a Monday, and I wasn't bouncing back. And that was really unusual for me because I've worked on big complex projects for like over 20 years. I thought, yeah, something's going on here. So I went to for American audience, primary care doctor, PCP. She ran some blood tests. It didn't show breast cancer, but it did show some weird things going on in my blood work, strange things that were going on. And thankfully, she ran an enhanced blood panel. So she did the standard tests, but then she also ran additional tests, which is important because there was something flagged up there that she was really concerned about. And her words to me, which still ring in my head to this day, were, look, I'm concerned you might have a cancer somewhere in your body. Well, what am I meant to do with that? You know?
Yeah.
And I thought, okay, well, at that point, you're still thinking, no, it's not going to be that. Surely I just need some B12 or some iron or, something. It's going to be something else. But anyway, long story short, that kicked off a series of many weeks of going for tests on different body parts. Because if somebody says to you, you might have cancer, I mean, that's going to scare the life out of you, right?
You're doing every
With
self
me.
check and Dr. Google search you can.
Yeah. And it's like, I was still like, well, yeah, I was just baffled. And around the same time, so I had a darling cat. She's crossed the Rainbow Bridge now. So my cat used to always climb up me and lie on my chest. And around the same time, she started pawing at me and pressing her nose right on my chest. So
Wow.
I remember saying to someone, yeah, this is like odd. I think I feel bad. So my cat was around 12 when this happened. And I feel bad, really guilty, because I said to someone, I think the cat's getting old and going a bit loopy because she's behaving really weird with me. Meanwhile, I'm going off for ultrasounds, and yeah, tests on different body parts. So no, that organ's fine, that organ's fine. And the weeks are going on. I'm feeling worse and worse. Um, the cat's still doing her thing. I then went for a like a well woman checkup, and in this, and my blood work is getting worse as the weeks are going on as well. And so I was a bit like, yeah, I'm just getting really concerned. When I went for the mammogram was normal, BRADS 2, which generally is nothing to be concerned about. When I went for the ultrasound, echography is referred to in Spain, but the technologist spent a long time going over the same area. And if I'll be completely honest here, that's when I knew,
Hmm.
because that's the exact area that the cat was going to.
How long had the cat been like paying attention to that
So at
area?
this point, I'd had my cat. She was a rescue cat, and she ended up saving my life, actually. So by now, it was probably about 7 weeks, 7, 8 weeks. But as the time was going on, she was getting more insistent, like every morning, every night, and
Wow.
panicking. Yeah. So I'm feeling worse. My blood tests are getting worse. They've gone to this hospital for this well woman check, and I'm not getting any sensible answers from the consultant that I was seeing. She was throwing all kinds of stuff at me. Now, I had no classic symptoms of breast cancer. I had no lump that could be seen or felt. I had no skin changes. So I had none of the typical symptoms other than my cat going there, feeling exhausted, feeling unwell. And there's something called a CA125 tumour marker that was elevated. Now, that's normally associated with gynecological cancers, but it can, in some cases, be associated with breast cancer. Not often, but it can. So I said to the consultant, look, I'm concerned because this tumour mark is going up. I'm feeling worse. um, the ultrasound was rated as BRADS 3, which again is no cause for concern. But they did say there was a solid nodule. So I asked for a biopsy to be done or an MRI to be done. And I was told no. um, we're not going to do that.
Why
Come
did they
back in
say no? They didn't want to biopsy it. Did
um,
they have a reason?
because they had rated it BRADS 3, and as per the policy, you get referred for biopsies if you're BRADS 4 and above, and they
Okay.
classified it at BRADS 3. So this is where I started to discover all about guidelines and protocols and all this fun stuff, right? So I again asked, got declined. This consultant was actually quite rude. She actually had a go at me for organising additional scans that I was doing. So I actually ended up abandoning that appointment at one point because I wasn't getting anywhere. Um, by this point, I did actually have chest pain, like a stabbing pain. So again, this is viewed as not so common. So there's a lot of myths and misconceptions around breast cancer. One of them is, and this actually comes from the medical field as well, is that it's not painful. So I said to this consultant, look, I'm getting a stabbing pain in my chest now. She's like, oh, it's your hormones. And at this point, I was 43 years old. So I said, look, I'm 43 years old. I've never had a stabbing pain in my chest before. Like, this isn't, I know my body. This is not my hormones. Something else is going on. Anyway, couldn't get anywhere with her, couldn't get anywhere. So I abandoned the appointment. Do you know what people are like? People are like, well, your mammogram's clear, your ultrasound's clear. And but I knew by then something was wrong because I would just, again, wasn't feeling well. The cat was still doing her thing. Went home that night and the cat, again, same thing. So I thought, you know what? Okay, I'm just going to book myself an MRI. So went off, did some research on the internet, found this amazing MRI diagnostic center in a local town, run by Executive Health Marbella. So it's in Porto-Banús. And I was able to go there for an MRI. And the chief physician that runs the center, he really listened to me and took on board my concerns. So he's like, yeah, of course, like, we'll give you an MRI. So I went in for the MRI and then boom, there it was, the exact spot the cat had been going to. Had a biopsy organised within a week, went for the biopsy. Again, that's something I had to pay for the biopsy, had it confirmed. And I've had really polarizing experiences. So I had what I deem a negative experience with that one consultant, which I never went back to. But Dr. Reinhard, that runs this centre, was absolutely fantastic. I mean, he was chasing my biopsy result whilst he was on his personal holiday with his family. Now, this was in the summer of 2021. And out here, so I'm based in Spain, a lot of facilities will close down or go on to skeleton staff in August because it's the hottest month of the year. So by him chasing up my biopsy result, sort of going above and beyond in his personal holiday, it meant I could then get into surgery before the August or summer shutdown. Otherwise, I would have had a delay of 4 to 6 weeks. So I'm super thankful for that. So it's been really contrasting experiences. So that's how it got found the first time.
Well,
so I was 43 years old.
and it speaks to the importance of self-advocacy. And again, many times we are encountering families who have experienced something after diagnosis and they have to advocate for a therapy or additional treatment or even a second opinion. But you said some key things that I don't want to glaze over, is to know your body and talk, advocate for yourself for that doctor, because there are, I mean, story after story about clinicians, and I know clinicians care about their patients, but they'll bring bias into a situation that says you're too young to be a cancer patient, or everything with respect to our guidelines. Like, guidelines are not golden. Guidelines are just what they say. They're guided, but there are outliers in that. And if you want a biopsy or a scan or something else, and they tell you no, have the courage, have the confidence to continue to search, because all physicians will not have the same opinion or disposition with dealing with you as a patient.
Yeah, that's absolutely key. I can't stress enough to everybody out there to really know your body and know you're normal. So something might be normal for many other people, but it might not be normal for you, right? That's what
Yeah.
happened to me with the chest pain. I was like, well, okay, you're saying it's normal. It's not normal for me. Um, and it does take takes a lot of energy to advocate for yourself. Um, it takes a lot of courage because of it's an intimidating situation to be in anyway, right? Particularly and physicians and medics. I've had polarized experiences throughout the last 3.5 years. That theme has continued, right?
Yeah.
So I've come across amazing, fantastic senior physicians, surgeons, oncologists, and I've come across others that don't fit that category.
Yeah.
And it is intimidating to question them, basically. But what I will say to anybody is ultimately it's your life. No one's got a bigger interest in your life than you have.
On that topic of guidelines in your research in the UK, and you mentioned that you at this time were in Spain, and I don't know what the breast cancer screening guidelines are in the country of Spain, but you mentioned in the UK the routine breast screenings don't start until the age of 50,
Yeah.
and in the United States, it's 40. In fact, the U.S. Preventative Services Task Force recommends that women at an average risk for breast cancer begin screening with mammograms every 2 years, starting at age 40. You've been very vocal about changing those guidelines in European countries. Why is it important to start screenings at age 40?
What the data is now showing is that around 21% of breast cancer cases are under 50. So that's instantly 20% of women that would be omitted from being able to access screening. And in many cases, you can't even self-refer. You're completely excluded out the process. So 21%, that's a sizable figure. That's under 50, right? And then, because I've been tracking what's been coming out of European countries, the UK, and also the US. I've been following what's been going on in the US quite closely the last 3+ years. Um, and a recent report is referencing a surge, in quotes, of breast cancer cases in women in their 30s, even. So the landscape of breast cancer itself is changing, and 50 is just too late. And I know that the US, it used to be older, and I think was it approximately a year ago, your task force reduced it down to 40. Many other European countries, they have reduced it down to 40 because there's acknowledgement that 50 is just too late and too many women are missing out on the screenings. When I've been in all these waiting rooms, whether it's surgery, um, radiation, medical oncology, wherever it may be, for breast cancer, my personal observation is every other woman I've seen in there is under 50.
Mm.
Now, technically, if there's 20% of cases are under 50, I'd have expected to see a larger, older patient group. And I'm not seeing it. I'm just seeing literally all of them under 50. And then after I went public on LinkedIn, which was quite a big step for me to do, to go public with my diagnosis, but there was a few different reasons I did that. I had former colleagues and friends in the UK that went for screening tests who were under 50. But some of these, most, I think all of them actually, had the benefit of having private health insurance, which meant they were able to access more screening entitlement than on the public system. And 3 friends or former colleagues after I got diagnosed have been diagnosed with breast cancer.
Wow.
So one at 37, one at 42, one at 45. And somebody phoned me just a few weeks ago to say, oh, Gemma, like I worked with you 15 years ago. I've been following your story on LinkedIn. You're not going to believe this. I've just been diagnosed too. So something's going on, and I feel like these women should have the right to have access to screening to get picked up early, because we all know the best chances of survival is early detection
Absolutely.
and appropriate treatment plans, which is where we get into genetics and genomics, right?
Yeah.
So it's So this is why I'm such a strong advocate. 50 is just it's no longer appropriate, and a lot of this is driven again by politics and economics.
That's a huge point to make, you know, um, because again, we just said there's outliers. Guidelines are just that, guidelines, but there are outliers. In fact, according to breastcancer.org, globally, cases of women being diagnosed with breast cancer before the age of 50 has increased by 80% in the last 30 years. And so it takes a while for the published evidence to catch up to what's actually happening in our world. Do you mind sharing your subtype, your molecular subtype
Yeah,
of
of
breast
course.
cancer?
I just want people to be aware of this if they find themselves going through the process. You have a pathology report from your biopsy, and then you have a second pathology report from surgery. Now, what you get told in your biopsy pathology can differ when it comes to the final pathology report from surgery, right? So when I had my biopsy, for example, my lab pathology result came back as grade 1. So I thought, okay, not a great situation to be diagnosed with breast cancer, but it's grade 1. So for anybody who's watching who's not familiar with this, the breast cancers get rated grade 1, grade 2, grade 3, and it's based on how the cells differentiate. Grade 1 cells typically being slower, less dangerous. Grade 3 being typically more aggressive type, where cells grow and spread more rapidly. So when I got my biopsy report, it said, oh, grade 1. So I thought, well, rubbish situation, but something of a silver lining. Had my surgery, got my pathology report, grade 3. Oh, okay. That's not what I wanted to see at all. So the first diagnosis was estrogen hormone positive, effectively. HER2 negative, luminal A. It got rated a positive KI factor and grade 3. So that puts in a much greater sense of urgency with it being a grade 3 and having
Yeah.
those cells roaming around. So that was my first breast cancer.
Now you mentioned first breast cancer. So, what your course of treatment was, you went into remission. How long were you in remission, and what happened when you rediscovered?
I had a lumpectomy. I then went straight into radiotherapy. Now there was problems that happened, errors within the medical system that happened back then. So you get your pathology report back, and depending whether you're HER2 negative or HER2 positive, depends how medical oncology treat you. They're two completely different treatment paths. And again, I just want to make a general point to anyone watching, because breast cancer gets lumped together. But the best description I've seen of it is that it's actually a collection of diseases.
Right.
There's many different types of breast cancer. And there's many different subtypes of breast cancer, and they all have different treatment plans, different prognoses, different outlooks. So it's a very varied, varied landscape. So I had my surgery, went to see an oncologist. They looked at the pathology report, and they went, really sorry, Gemma, but they've missed off doing your HER2 test. We don't know how to treat you. Yes, exactly, Rome, right? I was like, okay. And the surgeon was independent. So this wasn't all under one hospital. It's very fragmented. Rather than anyone apologize to me to fix this, it was put on me to get it solved. to find a lab to do the HER2 test.
So they just couldn't order the test?
No, they wouldn't. They said, their mistake. I had to be the one to find the lab, get it all ordered. When I'm still recovering from surgery, right, then I actually had to, I found a lab, got it authorised, that went through insurance. I got told I have to physically go to one laboratory, pick up my tumour, take it across the city to the other specialist lab that can do this test. I said, don't you have medical couriers to do this? Like, a patient should not have to collect their own tumour and hand deliver it to another laboratory. And they were like, no, that's what you've got to do if you want to get it tested. It's like, well, of course I want to get it tested. It was only found the first time on MRI, so surely I should have like an MRI monitoring and control to make sure it doesn't come back. And I got told, no, the protocol is this. The system says this. It's like, yeah, but that doesn't fit my case. And you go around in a circle. It's like, the system says this, the protocol says this. So no, you're not going to get an annual mammogram. Okay. Annual MRI. So I started to then have to pay. I was paying for my additional scans and screening because the first time I've had a cancer, not show on mammogram, not show on ultrasound, not show with the typical biomarkers, and none of the classic symptoms or signs. So I was sort of feeling it's a miracle to be alive, Rome, right? So in August of 2023, I went for a mammogram and an ultrasound, like screening control checks. BRADS 2, they said, yeah, you're fine. Same conversation, more self-advocacy, Rome, right? I went back to see the surgeon and I said, look, basically got major anxiety because I need an MRI because we know the cancer didn't show the first time, so I'm not feeling reassured by the standard screening checks for my case. Literally got told, get on with your life, put it behind you, move on. I was like, yeah, not really happy with that.
Yeah.
She was like, it's BRADS 2, nothing to worry about. Yeah, that's what I was told in 2021. A couple of months went past, Rome, and this one day, my darling cat had crossed the Rainbow Bridge at this point, so I didn't have, my cat was no longer here. And this one day in November, it was just on my mind so much. So you know what? It got missed the first time. And I just had a feeling, like sometimes with breast cancer particularly, you hear people just get the result on a screening check and be like, oh, I felt fine. I had no idea I had a tumour. But then you'll get other cancer patients like me who are like, I knew something was wrong, but I didn't know what.
Yeah.
And I just had that weird feeling in November. It's like, oh, it was just playing on my mind. I'm going to take a day off work and go and get some MRIs done. Which, again, I had to pay for because on paper, there's no reason to give me an MRI because my ultrasound and mammogram's clear, right? I took a day off work, went for MRIs, was in the office the next day, got a text from the medical office. At this, again, I went back to the amazing centre that found it the first time. I literally trusted Dr. Reinhard and his team with my life. I got a text saying, "Can you take a phone call in 5 minutes?" And I thought, oh no, I'm in trouble.
Yeah.
I took myself off to a meeting room, phoned me up, and said, "Really sorry, it's back." And that's how it got found. So my second surgery, it's mastectomy. I changed surgeons from the first surgery, and I changed treatment teams, and I changed hospitals. Again, if something doesn't feel right, if you don't feel comfortable
Trust
in a
your
place,
instincts. Yeah.
you've got to trust your instincts. But also, like I say, I'm very rational. I do consider myself pragmatic and evidence-based as well. And if I wasn't getting answers that made sense, a critical timeline that could have increased my survival odds by 30% got missed at one hospital. So I was a bit like, yeah, no, I'm not feeling safe anymore. I'm going somewhere else. My breast cancer surgeon, there was 3 of them, but this one of them in particular was amazing. So I spoke to him about it. I said, look, I really want BRCA and 16 genes testing. So he's like, well, if you get it done, you're going to have to accept the result and be prepared to do something about it.
But at least he didn't tell you no or somehow balk at the idea that you wanted more information.
I mean, he was a bit reluctant, but gave him my rationale, and I was like, I'm intending to do it. I'd really like you to support me, basically. So I started the conversation with him. This is where it gets more interesting. I then went to see an oncologist at the same hospital who happened to be the head oncologist. And I said, look, I'm concerned the cancer had come back. I'm planning to get the BRCA plus 16 genes testing done. I got told it wasn't necessary. I didn't need to worry myself about that, unquote. And I sat there and I'd gone into this appointment room thoroughly researched, right? I wasn't going in there asking for answers. I'd done my research prior to going in there. And he basically refused me the BRCA plus 16 genes test, wouldn't do it. And I sat there and I thought, he was head of oncology for 20 years. He was explaining to me, don't need this done. He said, it's not going to make a difference to the treatment or the outcomes. And as soon as he said that, I thought, you know what? It does make a difference. Whatever the result is, if you come back with a genetic mutation, whether it's BRCA, CHEK2, PAL-B to ATM, whatever, it does make a difference. So instantly I thought, yeah, no, I cannot get treated by a medical oncologist that has got this attitude. So anyway, he full on refused to sign the paperwork. So I sat there and thought, how much am I going to have? This could end up in an argument. And I thought, I've already got the surgeon on board. I'm just going to take the paperwork to the surgeon for the surgeon to sign it off. And I'm just not going to come back and deal with this guy again, because I've got to manage my stress levels, my time, my energy. He wasn't moving. So I thought, okay, we're back to see my surgeon, got the paperwork signed, came back, check 2.
Since your diagnosis in 2021, you've become, quite a citizen scientist, if you will, diving into the world of genetics and genomics. Goodness, you've taken courses at Yale and Stanford schools of medicine to learn about breast cancer and survivorship. You have a certificate in precision medicine and epigenetics and genomics from the University of Geneva. What are some of the things you've learned through this process, and how has this impacted your advocacy for yourself, but not only for yourself, but for others as well?
This is where the self-empowerment comes in as well. I wanted to do as much as I could to help myself. I do believe that with the medical field, to me, it should be a partnership. So as much as they bring things to us, I think it's beneficial, or for me anyway, to do as much as I can to live with a clear head, knowing I'm doing as much as I can to help my body to get me through the other side of this and to stay alive, basically. So I was looking for information primarily. That's what led me to do these courses, information that would help my particular case. And then it became a bit of a general interest as well. What it meant is it's helped, some of the courses in particular, helped shape my approach more. So being very scientific in how I was approaching things. So if I was discovering something from an epigenetic point of view on a course, for example, I'd be like, right, how can I apply that to myself? What techniques, protocols can I do on myself? And then I'm like, okay, well, how do I measure that? I need to know what I'm doing is effective and efficient and it's going to make a positive difference. So then it was about arranging, for example, blood work to test what I was doing. So for me, it's had a lot of first-hand practical application as to certain enzymes, to upregulate or downregulate them, switch things on, switch things off. There are modifiable things like this that we can influence. So I've used that knowledge that I've acquired on these courses to apply them to myself. And then what I'm trying to do, or been endeavoring to do as I've been going along, is post on social media platforms information as I come across it, whether it's LinkedIn, sort of Facebook, Instagram, what have you, to disseminate the information, to get it out to other people. Because all of this information I had no idea about until I got diagnosed. Why would I? I'd have no reason to. But what I want to get across to people is, right, I hope nobody gets diagnosed, right, with this, but the stats are appalling, 1 in 2 adults, right? So it's like there's changes you can make 5, 10 years before that can reduce your risks and give you the best likelihood of supporting your body to reduce your risk, to lower your factors where you can. Now, some people are going to be, oh, I'm going to live my life anyway. Totally cool. As the saying goes, you do you, right?
Yeah.
But my thing is, there's things you can do, like information I know now. If I'd known about when I was 30, 35, I would have done some certain things differently. I wasn't doing anything bad, wasn't living a bad lifestyle or anything like that. But there's certain things I've come to know about in my DNA that I could have influenced more with very particular lifestyle and epigenetic changes if I'd known 10 years before. Now, may not have stopped me developing the cancer, particularly with CHEK2, but number one, I would have had a double mastectomy and avoided it in the first place. 2, would have lowered all my risks down for the other types of cancers as well. And at the very least, kicked it as far down the road as possible. Like, the cancer, I'm trying to be as open as I can to help other people.
And we
And I feel like
appreciate
I'm
that.
stating
Yes.
it
Yeah.
so obviously, but the cancer world is not a place you want to be. And breast cancer, particularly, has got the mislabel of the good cancer.
Hmm.
It's brutal, which is why, separate topic, but you'll never see me wear pink for that reason. But yes, so I set about educating myself. I wanted information, I wanted answers. It's hard to connect to some specialists, you've got to find them, particularly with CHEK2, which is more rare. So I thought, okay, I'll educate myself as much as possible. Super simple example, Rome, is this. Now, I'm not saying what I'm going to say cures CHEK2. It doesn't. It's a CHEK2 problem. But medical studies have established a link between selenium levels in your blood and CHEK2 outcomes. So you don't want low levels of selenium in your blood. And equally, you don't want high levels of selenium in your blood either. And selenium is a nutrient that we can easily influence through diet. So, for example, just have 1 or 2 Brazil nuts a day, and providing you eat a healthily balanced diet, that's your selenium levels should be optimal, right? So I thought, okay, that's interesting study. I was reading these medical studies. I read white papers, so I don't get my information from generic websites because, to be honest, a lot of it's poor quality, it's outdated, badly written, not specific enough. So I go to like PubMeds, I go to the NIH libraries, these resources to read these medical papers. So I thought, okay, well, if I know what my selenium level is, it's not going to fix my CHEK2 genetic issue, but it's going to put my body in the right place dealing with it. So I'm after as many small incremental wins as I can get, because I kind of, for me, believe a perfect storm created the situation. Therefore, I want to do as many small things can build up and have a powerful effect to help better my situation. So I thought, okay, well, first I need to know what my selenium level is in my blood. So I went to my primary care doctor. Thankfully, I have an amazing primary care doctor, and she's very much like me. She's data driven. So I've never had to advocate with her, Rome. This might come across in this podcast like I'm heavily advocating or fighting for a lot of things, which, to be honest, is true. But there have been amazing physicians as well. And my primary care doctor is fantastic. So she's data driven. So when I go, oh, like I need my blood work done, I need to compare following anti-inflammatory diet, for example, because inflammation is linked to cancer. So it's like I'm tracking inflammation markers in my blood. She's like, yeah, sure, no problem. I'll get that done. One day I go and see her. I said, oh, Dr. Tatiana, I need a blood test for selenium. She's like, what are you up to now? She's like, what are you doing? I said, I need to know what my selenium level is. It's like, never had a patient ask me that. So it's like, here's the research papers, here's the study. This is why I need it. She's like, yeah, sure, signed it off, no problem. Off you go, you know. So yeah, so that's one very detailed epigenetic, super small thing. I'm just, like I say, I'm just trying to get the odds in my favor where I can, do the things I can do, modify the factors I can modify. Um, it's very empowering,
Yeah.
you know, it's like, it's very empowering in a situation where you have no control effectively, or you're made to feel you have no control. My job over 20 years has been a senior project manager, program manager. So I'll be honest, I'm used to being in control to some extent, having mitigation plans, risk management plans.
Yeah.
And I've gone into this medical cancer world where there isn't any. My brain can't cope. Can't cope.
The key is, we hear this statement that knowledge is power. And that's not necessarily true. Knowledge is not powerful until you apply it. And
Action, knowledge, power, action. Yeah.
absolutely. So Gemma has done that, advocated for herself, found the information to be a more effective partner in her care with her caregivers. And that's what we're all challenged to do in any area of our healthcare. And, we've been talking about this the entire time around self-advocacy because, the incidence of cancer globally are increasing and patients diagnosed with cancer are getting younger. And the I guess the dilemma there is patients are actually living longer. Cancer patients are actually living longer due to the innovations with therapy. A lot of it is being attributed to genetic and genomic implications or information that implies certain treatment options for you. So we want you to be empowered with the right language, the right questions, the resources. Many of them Gemma has been discussing here. But Gemma, specifically, I want you to talk to young women and young men out there that have been diagnosed with cancer or any chronic disease at a young age. What are 3 practical tips or suggestions you would give them to help advocate for themselves for a precision medicine approach to their care?
It's going to sound ridiculously simple, but I'm going to start with this. Breathe. Before you go into these appointments, breathe and ground yourself before you do anything.
Yes.
Take your time, arrive early so you're not flustered, because that's going to just spike your anxiety up even more. By nature, these are quite intimidating appointments, very self-confronting. You're discussing your mortality, it's emotional and mental overload. At the same time, you're trying to push forward your personal agenda of survival, right? So yeah, number 1, breathe, ground yourself. If you can, I'd recommend taking somebody with you, somebody who's very trusted, that you trust your personal well-being and information with you to appointments, because it's an overwhelming situation to be in and you're not going to remember everything that you're told. And if you have somebody with you, they can redirect the conversation if you forget stuff due to overwhelm, if your brain shuts down. My brain shut down on occasions. So bring somebody with you. The third thing I would say is have some quiet time before the appointment. Think about what it is that you need to get out of the appointment. What information do you need to know? Now, you might have quite a big list of questions, right? And this is where I've applied my professional background to my appointments. So, okay, got a list of questions, but what's the 3 things I have to come out of this meeting, like a work meeting, knowing I kind of go into work mode a bit, and have your priority questions at the top. What absolutely must I need to know to find out about before I walk out of this room? When you do go to appointments, have an open mind set, which is you might have planned out an agenda in your head of what you want to talk about. The specialist in front of you may have a set of test results, for example, that throws it all on its head. So to go in with a mindset of, okay, still need to know about X, Y, and Z. Okay, this appointment's gone down a different route than I was expecting. Where do we go from here? What I'd also say to people is write down your questions in advance. As they're giving you the feedback, take your time and write down the response word for word as they're giving it to you. Because what you might find happens is you ask your questions, they answer, they might answer fantastically well. You move on to your next question, so on, so on. And you think, oh, I'll write it down when I come out. You won't, because the level of information is too much and your brain will be on overload. So don't, when you are in appointments, don't feel rushed. You might feel rushed, but don't. Just say, oh, I'm just going to need like a minute. I'll be as quick as I can. I just want to write it down as you're talking to me. That way I make sure I've captured it correctly and I understand it. If you're not sure what someone said, ask them to repeat it to you. That's perfectly fine. And I think the fundamental point is, I think pretty much everyone would agree with this. You've already had the worst conversation of your life, right? Getting the news is the worst conversation of your life. Like if you're feeling intimidated or concerned or fearful about advocating for yourself, or it's something I've learned to do, right? I've had to learn through experience, right? And sort of step into my own power, as it were. But if you are feeling apprehensive or nervous, just remember you have had the worst conversation of your life. These conversations are designed to help you get the right treatment you need for the situation that you're in. So when these particular young people are in appointments, to listen to what the specialist says, but not to be afraid of, let them explain, but not to be afraid of asking questions, getting them to explain it. I've asked them to draw me diagrams, like, yeah, okay, can you explain this in a diagram? I need to
Absolutely.
understand. And, good doctors will, they want you to understand, right? It's, like I say, it should be a good partnership. When it comes to the genetic side in particular and the genomic side, some physicians will lead on that. So I know there's some centres where they're very proactive about genetic testing, very proactive about genomics, and they'll give you all the information, right? But don't be afraid to ask. It's your body, it's your life. You need to understand, I believe, you need to understand what's going on so you can get the most out of the process yourself. So ask them if they say, for example, I don't know, if they bring up the issue of genetic testing, ask them how it's going to affect you and your treatment plan. If they haven't brought up genetic testing and you're a young person, go in there with some stats. Say, look, I'm concerned. I'm a young person. Why have I got this cancer now? It doesn't make sense to me. Like, I would like, for my peace of mind, I would like, I feel it necessary for genetic testing. Just throw it out there. Nothing bad can happen from asking, right?
Yes.
But the thing is, the challenge is the power dynamic. You're there terrified, fighting for your life. You're dependent on somebody to help save your life. So it is difficult. And I understand, particularly if you're younger, it is difficult. Yes, I would say, yeah, do your research, calm, ground yourself, write everything down. And there's amazing information out there as well. There's some amazing support groups and information points, such as My 40 Gene, there's Force, Facing Your Risk. There's some amazing organisations if you are concerned about genetic risks. And they can also help you with ideas of questions to ask as well. I'm actually planning to do a post on tips to help somebody advocate for themselves, Rome. So I will put that
I
up
think you should. Certainly, because this is what this podcast is all about.
Yeah.
And again, I want to reiterate, it's not so much, don't hesitate to write your questions down, because
Yeah.
A physician that I interviewed on my podcast says, listen, he appreciates that because in the course of their conversation, some of those questions are answered, but if they don't answer those top questions and you have some, he's happy to answer the most important, but he said he will call them back, or they can answer those in your chart or email them to you at some secure way if it's not my chart. But get the answers that you need. Be very intentional about that. And even with resources like Genetics for Healthcare, the purpose is to get this information to start the conversation, to introduce the conversation to you, so you might be inspired to do your own research and bring those questions back to your caregivers. So, Jemma Sutton, thank you so much for sharing your story of grit and resilience, and encouraging all of us to be advocates for ourselves and standing up for what we want in our healthcare. Thank you for being a guest on Genetics for Healthcare.
You're very welcome, Rome. Thank you for having me. I think what you're doing with the platform is fantastic. So impactful for so many people.
Well, we're nothing
and it gives
without
me hope
you.
For everybody.
Yeah.
This is Genetics for Healthcare, a podcast for patients.